as in the region, we are seeing an increasing burden of NCDs, but thankfully there is also an increasing awareness about NCDs, and the community is very active in physical exercises. The hills are not being put to waste. Every morning, every evening, people are climbing these hills, and so I'm sure that the burden will be averted in the long run. So I appreciate Kabale community for taking on our health messages and being able to put them to reality. However, as I conclude, I have just 2 or 3 concerns which I think as leaders we need to continue to drumming up for. One is that the use of, in Kabale they call them hardcore, some of them call them iron bars, the hard drinks. The hard drinks are becoming so popular. It's trendy to be able to spend an evening and take a number of bottles of Grand Y, Grand X. It is trendy. If you are one of those who do not use them, you feel out of place.
And by the year we reach 2045, we shall have about 745 million people having diabetes. Now, the sad thing is that 75% of this increase is going to happen in third world countries where Uganda is. We are also not data from the STEP survey which was done by Professor Bahende and the Ministry of Health. We have seen an increment in the cases of people living with diabetes. The numbers have almost tripled. And this is because of the increase in the risk factors. We have just been told by the WHO that when it comes to Kabale, when it comes to alcohol, people consume lots of alcohol, people consume lots of unhealthy diets, and this is affecting us in Uganda, both in rural and urban areas. The same study actually has shown that there is no big difference between the cases of diabetes in rural and urban areas, and that is very worrying. Again, from the same study, we note that more than 50% of people don't know that they have diabetes. And this is also not very good on us, because many of our patients will present with complications which are very expensive to treat, and in most cases fatal.
The fight against NCDs, one of the things that you have seen, NCDs are the leading cause of death in this country, and I think they are leading cause of, and they are the ones that are taking a lot of money in the country. So many people are living with non-communicable diseases, and a lot has to be done to ensure that we control. If we don't do that, our country is likely to go bankrupt because of the people who want to be treated, and we must emphasize prevention, prevention, prevention. I thank you.
The costs of managing NCDs, diabetes, hypertension, but since we are focusing now on diabetes, let me talk about diabetes. The cost of managing diabetes is too much for this country. We cannot handle. The cases keep on increasing, yet the budget is more or less static or even reducing. Once you develop these conditions, you are always on medication for life. And for those who develop complications, the cost of managing the complications is even too much, and we don't have the specialists to manage this in most of the facilities, save for the regional referral hospitals and at the islands. So the message today should be to prevent, and also to give hope to those who are living with diabetes that we have means to tackle diabetes.